Hello everyone, this is Dr. Suresh Patil. I am a joint replacement surgeon, performs hip and knee replacement surgery at American Orthopedic Center. Currently I am practicing in Pune, as well as I frequently visit in the United States to perform hip and knee replacement surgeries. So today we are going to talk about how we can avoid or delay knee replacement surgery. There are various factors or there are various ways you can delay your knee replacement surgery. Let's start with activity modification. That means you have to modify your activities that causing pain in your joints. For example, avoid high impact activities like running, climbing stairs, and you can also avoid activity that puts a lot of stress or force on your joint like squatting down. Avoiding this activity will help you to decrease your pain. The next important thing is weight loss. That means if you are a morbidly obese patient, then consider losing a weight. It will help you to delay and avoid your knee replacement surgery, as well as it will also help you in the future. If you undergo knee replacement surgery or hip replacement surgery, then it will also help you in the future to avoid the risk and complication associated with morbid obesity. Then the next important thing is physical therapy. You can increase the range of motion of your joint, increase the strength of your joint. Physical therapy also help for increase the proprioception of your joint receptor, which indirectly help you for better walking and decreasing the pain of your joint. Then the next key factor that will delay or avoid your surgery is injection. We will talk in detail about injection in next videos, but there are two types of injection we commonly perform. One is a steroid injection, that is glucocorticosteroid or cortisone injections that we put in your joint, which helps you for relieving the pain, inflammation, and overall improving your function. And the other injection is gel injection that contain hyaluronic acid, which lubricates your joint. We'll discuss them in detail in next few videos. Then apart from these activities or this factor that we discussed to delay your surgery, other activities involve bracing. That means you can use brace or support in your knee joint, especially if your knee joint is worn up or having arthritis only on one side. Then using a special type of brace will decrease the load of that part of the joint which is having arthritis and will transfer the load to the other side, which is a normal joint, or the part that can take a load of your joint. So these are the different ways you can delay or avoid your surgeries related to the knee arthritis, that is a knee replacement surgery. Please follow us and subscribe us to listen more about your health. Thank you.